Good afternoon, students. Myself, Dr.Swanand Shukla, Professor, Community Medicine Department, Motiwala Homeopathic Medical College and Hospital. We are dealing with the topic that is occupational health. We have already done certain topics like ergonomics, what is the occupational environment. Then we have discussed about the occupational hazards. Then we have discussed about occupational diseases like dermatitis, cancer, leukemia, pneumoconiosis. And then we started with the topic what is called as prevention of these occupational diseases. So here, today we will pay attention to the legislations. We have done with medical measures, we are done with engineering measures, and today we will deal with legislations. Now what is legislations? Legislation means a law. And why we require law? Because if there is a law, it becomes an obligation, it becomes compulsion. And if you are breaking this law, the act is punishable. So to prevent these occupational diseases, certain legislations are there. So what is the specific learning objective? Knowledge-wise, a student should acquire the knowledge about these legislations, the law for protecting the health of a worker. Skill-based. So when you will be in a practice, how you are going to implement these laws, and you will see the working environment of the worker, and then you will see to that how we can implement these legislations. And the last one is very important, that is aptitude skill or aptitude based. So during the DHCS visits, you are adopting families and some of them must be working in industry. So making those people aware about these laws and legislations, and mind you, why legislation is there? To secure the health of the worker. So we can utilize this. Now what is the objective of legislation? So two important words what I could find it over here. First one is an obligation. Obligation again is a compulsion. So law makes the things mandatory. And another thing is law governs the condition of industry. So maybe the working environment, maybe the hours of working, and so on. So these are the two important aspects a student should know. There are two legislations. One is called as Factory Act and another one is called as ESI Act. So first we are going to talk about the Factory Act. So here, this act is applicable for whom? So this act is applicable for the people who are working with the industry, 10 and more workers where the power is used, and 20 and more workers where the power is not used. Power in the sense, electricity power. So it is applicable for all those industries. A very important clause is health, safety and welfare. So when a worker is dealing with some industrial procedure, he is exposed to chemical, physical, biological agents and he is liable to develop certain conditions. To protect workers' health, it should be the objective. So it includes cleanliness, maintaining cleanliness and hygiene about the working zone or maybe the toilets. So that will promote health and maintain health of the worker. Lighting conditions. So when we are saying lighting, when they are working in one particular area, there should be a good illumination. So it will not create a kind of stress to the eyes of the worker. So lighting may be artificial, it can be natural lighting. Then comes ventilation. Now what is ventilation? It is a replacement of vitiated air by fresh outdoor air. So there should be changes of air inside the working area. So it can be achieved with the help of artificial means, like we are using exhaust fan, we are using plenum fan, or we are having nowadays air conditioners. Or we can use natural forces like wind, like diffusion, perfusion, cross ventilation, and we can improve ventilation in the working area. So it is monitored under this Factory Act. Then it also treats, it sees, it observes, it keeps vigilance on the treatment of waste. So waste may be inert, maybe a toxic, maybe a liquid, maybe a solid, maybe a fume, maybe a soot. So before discharging it, it has to be treated. and then it should be discharged. If it is indiscriminately discharged into the ambient air, definitely the health of the worker will get deteriorated. Elimination of dust and fumes, I said, and then certain facilities like provision of cool drinking water. So some people are working in a hot environment. Their body temperature, their hydration should be maintained. And that is why this kind of facility should be provided under the topic that is health, safety and welfare. Now what about employment of a young person? So the children should not be employed for industrial work procedures. It is prohibited. But here I would like to add that adult sons can work, that is age group in between 14 to 18 years. But again there are regulations of their working hours. Now hours of working, how much duration they should work? So 48 working hours per week, that is recommended. It should not exceed more than that. And 9 hours per day, it should not exceed. Sometimes over timings and all aspects are there. It may impair the health of a worker. So it has to be monitored under this act. What about leave and wages? So they can avail 1 weekly leave. Apart from this weekly leave, they can have 1 day leave for 20 days working days and 1 day for 15. So for adult, 1 leave for 20 working days, and for children 1 day for 15 working days. So that is how they can avail leave along with the wages. Now we are coming to the occupational diseases. So as we know, they are most liable to get they can suffer with various occupational industrial health problems. So the mine workers, like people who are working in a radiology mine, uranium mine, they can suffer with what is called as radiological hazards. Or the people who are working with a very hot processes, they can develop heat syncope or heat stroke or some other conditions. Or more than that, you'll find the people who are working with asbestos, they develop asbestosis, one kind of pneumoconiosis. Dermatitis is very common among the industrial workers. I will add various conditions, cancer, leukemia, and all these conditions, it is mandatory by this act to notify. Now what is notify? Notification means registering these disease conditions, maybe the death, maybe injury, maybe disease conditions, has to be reported to the governmental agency. So by law, it is mandatory. If suppose some industry is not doing it, their act is punishable. Then comes hazardous process. So there is usually a committee of 14 people who keep a vigilance. These hazardous procedures are carried out away from the main unit, and it has to be monitored by various means. So that is one thing. So here we have completed the Factory Act. Now we are going with another very important aspect, that is ESI Act, that is Employees State Insurance Act. So it has been established in 1948, and the amendment, that is improvement, has been taken in the year 1975 and 1984. So it is a very important measure for social security and health insurance. So these legislations, when we are talking about, it is applicable for whom? The scope of this law. So here it is applicable for the mine worker, the railway, the defense establishments, and then in 1975, this law has been amended and it is extended up to the small power using factories, 10 to 19%, and non-power using factories, that is 20 and more persons, then the shops, hotels, cinemas, road motor transport, newspaper. Not only that, it can be extended for clerical people, supervisories, technical people. It is applicable for those people who are earning 1600 per month, and then agricultural and commercial establishment. So a very wide applicability is there. And now we are coming to the next part, how this ESI work. So there is an organization for ESI, and it is called as ESI Corporation. Now this is a governing body of ESI. So when we are saying governing body, who is the chairman? The chairman is the Minister of Labor. Union Minister of Labor is the chairman, and Union Minister of Health is the vice chairman. Of course, this is an autonomous body. It is not regulated and governed by anyone, not by government also. So this is called as ESI Corporation. And here, who are the people, other people in this committee? So you'll find the members are representative from the state government, central government, employees, employer, lawyer, medical professionals, and some parliament people can be involved. Now this working body is run by 4 important executives: insurance commissioner, purely dealing with the insurances; medical commissioners, giving medical decisions; financial advisor; and actuary. Actuary means people who are dealing with the law. So now we have learned about organization. Now when we want to learn from where these funds comes. So these funds are coming from state government, the funds are coming from central government, the funds are coming from employer, and not only that, but the funds are also coming from employee. So employer contributes 5% of total wage bill, and employee contribute 2.25% of the wages. So that is how the funds are developed, and they will be utilized for the benefits of the employees. Now, we are coming under this act, the both are beneficial, like employee and employer. So what are the benefits of employee? So here we are having 7 things: medical benefit, sickness benefit, maternity benefit, disablement benefit, dependent benefit, and funeral expenses and rehabilitation. So usually I go with mnemonics, that is MSMD, DFR, that is M stands for medical benefit, S stands for sickness benefit, M stands for maternity benefit, then disablement benefit, then dependent benefit, funeral expenses, and rehabilitation. So very easy to remember. Now we are coming with the first one, that is medical benefit. The person who has insured under this act, he will get medical benefit like outpatient department, IPD, indoor patient departments, supply of drugs and dressing, specialist services, pathological, radiological health, domiciliary service, antenatal and postnatal care, immunization, family planning, emergency services, ambulance service, and then you'll find health education, very vital, health education. This medical benefit is provided through 2 systems. One is direct and another one is indirect system. Direct system means what? The ESI corporation has their own establishment, hospitals and clinics, and they depute people over there, and they are running their hospitals. And indirect means the private practitioners can be involved in this and they can provide services. So that is called as a panel, and they can also provide these ESI services. Now we are coming to the second one, that is sickness benefit. Now the person who is working in industry becomes sick, he is getting this benefit, that is sickness benefit. So it is in the 2 forms. One is cash form and another one is leave. So here you will find the periodical cash payment is given to this person, and near about 91 days. His benefit is payable up to 91 days for 365 days. So the sicknesses, 34 sicknesses are there, extended sickness benefit is there, and the diseases are infectious diseases, cardiovascular diseases, endocrine diseases, nervous system disorders, orthopedic condition, chest condition, psychosis, and several other conditions are there. 34 conditions are there. I have mentioned few of them which are very vital. It also includes psychiatric disorders. Now coming to the maternity benefit. So maternity benefit is of 2 kinds. Confinement benefit, and if there is an abortion, then the lady gets benefit in the form of cash as well as leave. So during confinement, a lady gets a leave, the duration 26 weeks, and for miscarriage 6 weeks. This can be extended if there are any kind of complications. And mind you, this is with full wages. A lady who is insured under this act, all these cash benefit as well as leave benefit. She is going to get it from maternity benefit. Now disablement benefit. Now what is disablement? Loss of ability. So if you are working in a industry and lost your hearing capacity for certain duration of time. So during that time you will require some help. So that is temporary disablement, what we can call it as. For that temporary disablement, 90% of the wages with the leave is considered under this act. And for the permanent disablement, if suppose someone has lost his limb and now he cannot be deputed again for the same work. So here this person gets a life pension under this disablement benefit. So disablement may be temporary, may be permanent. Now we are coming to the next, that is dependent benefit. In case of a death of an industrial worker, the dependents get their benefits. So 90% of the wages is payable. So this act makes it mandatory that employer should give 90% of the wages. So that is called as the dependent benefit. Now we are coming to the funeral expenses. So someone died. For those people, 10,000 amount is considered, but it should not exceed more than 10,000. Initially it was very less, now it has been increased on 11th, 2011. Now the last thing what we are going with, that is rehabilitation. Rehabilitation means what? It is the establishment. It is re-establishment of a worker to his place. Maybe medical, maybe mentally, maybe vocationally, maybe some reconstructive surgical procedures. We are doing rehabilitation. So no doubt the person is going to get a leave. But along with that leave, he will be getting his monthly payment with this rehabilitation. So we have finished with medical benefit, sickness benefit, maternity benefit, disablement benefit, dependent benefit, funeral expenses and rehabilitation. These are the benefits the employee is getting. Now what is the benefit of the employee? So employer also is getting benefited, very important. That is exemptions from Workmen's Compensation Act 1923. Then exemption from maternity benefit 1961. Exemption from the payment of medical allowances. The employer or that industry doesn't have to pay extra money for medical allowance. Rebate under Income Tax Act. And very vital what the person is going to get, that industry is going to get. If you are monitoring their all conditions, medical, sick conditions, their working environment, everything we are going to monitor. So what at the end we are going to achieve is healthy workforce. So with this, we have finished with these two legislation, that is Factory Act and ESI Act. So this is how we can prevent various occupational hazards. Now certain questions which you can expect in your examination paper. ESI Act, they can ask in question number 4, out of 4 write 2 for 10 marks. ESI Act. So you'll be writing what? Very important, what is legislation, why this legislation is required. Then you'll be writing the organelle of this ESI corporation, then the fundings, then the benefit of the employees and benefit of employer. Now to just think further and as a food to your brain, I want to ask one very important question, that is about the problem based. How you are going to utilize this knowledge now. I have placed here one scenario, that is the industrial health worker working in an asbestos factory since 15 years and he has developed breathlessness and cough. So the question comes, what he may be suffering from? Now from your occupational hazards we have learned number of conditions, diseases, so you can find out. What are the investigations you will suggest? So as we are dealing with very important word asbestos, so you can find out clues there for you. What will be the preventive action? How you can protect that worker who are working in such kind of industry. And very important is what we have learned today, legislation, how you are going to implement this legislation, what exactly you will be, action you will be initiating, that you have to mention. So these are the questions to you. You can answer it later on. With this, I think I'll conclude my session. We will be meeting very soon with a new topic. Thank you. Thank you very much.